Thank you very much, Bongi. Well, the Solidarity Fund has released its integrated annual report, to actually account to South Africans 18 months after it was established, just days after COVID-19 arrived on our shores in March last year. The fund has amassed 3.2 billion rands from donations made by the public, business and political parties, among others. The fund was established by President Cyril Ramaphosa as a rapid response vehicle to mobilize South Africa in the fight against the COVID-19 pandemic. Joining us to talk more about how the past year has fared is CEO Tandi Nzimande. CEO, thank you very much for joining us. Since the start of the Solidarity Fund, among many other projects, you have procured and distributed over 50 million units of PPEs across the country, 11 million units of PPEs for medical students. Give us a glimpse of the other work that you have managed to do in the past year.
No, thank you very much. Thank you for having us. It has been a tremendous effort that my colleagues, past and present, have managed to achieve. We have, as you say, we've got the PPE that we acquired, which was really at the time critical because it was for frontline healthcare workers, which included both in hospital and out of hospital, as well as the medical students that you refer to. In addition to that, we procured and assisted in the manufacture of locally made ventilators, which you will know are still a critical part of dealing with the pandemic, particularly when we've got the high waves coming through. Distributing those across the country, 18,000 of those were manufactured and in large measure delivered into the public system. We've got the essential equipment, which is something that we started in the hotspot provinces, but we rolled out across the country. The essential equipment was essentially to assist the hospitals to have more of the required type of equipment, varying from X-ray machines to renal failure-related matters, which were all linked to COVID. The different waves have come with slightly different requirements. In supporting in the hospitals through waves, in the more recent past, we've also been working with bringing more nurses into the system, particularly in Gauteng and in the Eastern Cape, to assist as the waves come and as they wreak havoc. In terms of the vaccination side, which of course started more this year, we have been able to support in putting in this was last year in December, putting in a deposit of 283 million for the COVAX deposit on behalf of government. And that has resulted in over 10 million vaccines that have come into the country. We've supported on technical assistance, bringing in additional people along in the national, provincial, as well as on district level for the Department of Health. We've supported the Sisonke study, which resulted in almost 500,000 healthcare workers being vaccinated with the Johnson & Johnson vaccine. And of course, apart from the health-focused areas, where of course the majority of our efforts have been in the health space, we have also in the humanitarian pillar focused our efforts in responding to the food shortages that arose and the impact that COVID brought, particularly with the hard lockdowns, where access to food became an issue, not only to those whom it was it was already an issue for. But in addition to that, there were many who had been in an earning capacity who are not able to earn the monies that were required to buy what was available. And
Tandi,
the Solidarity Fund stepped in.
While we're talking about the vaccines, let's talk about something that is quite crucial at this present moment. It's good and well that you have had a huge hand in bringing vaccines into the country. The problem that we have, the challenge rather that we have as the country right now, is convincing South Africans, those who are hesitant to take the vaccine, to actually do so. How are you going to manage to do that? What projects do you have in order to encourage those who are hesitant to actually take a jab?
Thank you for that. It's a significant challenge that we have, I think, as a country, and one that requires a big response. And the way that the Solidarity Fund is contributing to that response is that we have had already a campaign that came to an end in June, which was more about informing, just sharing information about the vaccine and encouraging people to vaccinate. We have another campaign that we're launching now, intended very much at the same outcome of making sure that we have more and more people going through to vaccinate. What we've encountered is that there's been a significant amount of misinformation going out into South Africa. And many people are therefore quite hesitant to vaccinate. But what we're hoping to bring is a campaign which will assist people in having a place where they can ask questions that can then be answered, rather than just, of course, we will continue with sharing information, but a much more interactive campaign and much more community-based. So through community radio stations, through young people out on the ground talking and sharing the information and receiving questions. And we're hoping that interaction will be taken up so that people who have questions, who are concerned that there may be other factors that have been brought in by perhaps the kind of misinformation that is out there, that we're able to speak to their concerns and address them adequately, so that we make sure that the whole country can move and we can give ourselves an even chance to see growth and progress again in the country.
Tandi, the latest approved funds are to refurbish the Charlotte Maxeke Hospital, really a cog of the health system here in Gauteng. But together also with the National Empowerment Fund, you've actually established a 450 million rand fund to assist small businesses. Tell us about this fund, how small businesses can actually apply, and what small businesses are you going to actually help?
Certainly. So we're very proud of the Charlotte Maxeke intervention that we've been able to bring to the fore. As you say, Charlotte Maxeke is a hospital which is such a central cog to the Gauteng health system, and houses a significant number of specialists and a significant number of ICU beds that are COVID oriented. So bringing in some assistance to Charlotte Maxeke and having parts of Charlotte Maxeke reopened will be a great help. As we know, there's an expectation, as we've experienced previously, that there will be another wave coming through. The experts tell us sometime November, December. And we are hoping that at least part of the hospital by that time will be ready to receive patients who will then benefit from the COVID facilities that are at the hospital. And then in terms of I've just gone blank. Help me now.
Hi, Tandi, are you still with us? Just the last question there on the issue of the 450 million rand fund for SMMEs. How can businesses, apply for this fund?
So we're very excited by this partnership with the NEF. A partnership that means that any and all businesses, all medium-sized businesses in impacted areas in KZN and Gauteng can apply using the NEF platform for assistance to recover. And it's an exceptional offer to businesses. The portion that comes from the Solidarity Fund will be styled in a grant format, and the part from the NEF in a loan format. We will be having a significant webinar on Thursday on it, speaking quite in detail about it. But the NEF, through the NEF unrest email address, which escapes me in terms of the exactness, but on the NEF webpage and on the Solidarity webpage, the addresses are available for businesses, all businesses across the affected areas in KZN and Gauteng can go to those websites and apply. There are also a significant number of NEF executives who are out on the ground already and have been on the ground, who will also, in the affected areas where they will have roadshows, and there's also going to be publicity around those. So people can be directed exactly where to go. Unfortunately, I don't have the exact details with me. However, on the website of the Solidarity Fund and on the website of the NEF, those details will be available.
Tandi Nzimande, the CEO of the Solidarity Fund, thank you very much for your time. It's good to remember that the Solidarity Fund is staffed with people who are working as volunteers and pro bono, who are seconded to work for free, and they've done a great amount of work.